So my name is Amber Johnson. I am the director of the Utah Poison Control Center, and I'm an assistant professor clinical in the Department of Pharmacotherapy at the College of Pharmacy here at the University of Utah. The Utah Poison Control Center has a long-standing relationship with the Utah Department of Health to aid in these type of public health emergencies. So mid to the end of February, the health department realized that they were in need of somewhere that could provide accurate information as well as answer questions for the public. So the Utah Poison Control Center was contacted, and with the help of our staff as well as the state and other healthcare professionals and volunteers, we were able to stand up the line on March 3rd. The hotline really has affected the number of daily calls coming in. So at our peak call volumes, we were seeing 10 times our normal daily call volume, and our normal daily call volume is about 125 calls per day. The students have been lifesavers in alleviating the pressure from the hotline, so it's enabled our staff to be able to more focus on the poison exposure calls that we were getting and allowing our volunteers to take more of the COVID-19 hotline calls.
My name is Carly Pelucas, and I'm a fourth-year student here at the College of Pharmacy. Actually, I was fortunate enough to have this assigned to me as a rotation as part of my P4 year. I think it would be a great way to learn about the concerns in the community and really understand what people are facing right now during this evolving time. I would 100% recommend coming to volunteer for the COVID hotline. It's a great way to hear about the concerns in the community and practice some patient-friendly language as we try to interpret complex recommendations into simple terms for them to understand.
My name is Connie, and I'm studying, Doctor of Pharmacy. I'm a fourth-year student at University of Utah College of Pharmacy. I'm volunteering partially because it was my clinical rotation that I was assigned to do, but I also wanted to do something with the Poison Control Center and be able to help out the public in a little bit different, more non-traditional pharmacist role. So yeah, that's why I'm here. So I feel like the experience with the phone, interacting with the public in this sense, I have not had a lot of experience with to begin with. So I was a little bit scared, but I think it helps me to relay important and comprehensive information to the general public without being too complex or complicated. I would tell other students, if they're considering to volunteer, to definitely do it. It is really unique opportunity that we have to volunteer in our own school. If anyone is considering to do it, I would say go for it, just do it.
To be a volunteer for the hotline, we've mainly had volunteers with a healthcare background. It really just takes a willingness to be able to adapt to changing information as well as changing recommendations, and wanting to learn how to communicate better with patients as well as to be able to address barriers that patients are having, like either socioeconomic or healthcare related barriers during the pandemic, all while assessing patients for COVID-19 and providing testing recommendations, as well as just helping the public stay safe. One of the rewarding things about the hotline is being able to work side by side along with all of the our pharmacy students as well as other healthcare students, and just how much we appreciate them and how much that this hotline wouldn't exist without their help. And they've all been so wonderful, and their attitudes really upbeat, and they just really want to help the state of Utah.